If you can't hear a child's laughter or enjoy the smell of a fresh forest in the morning, life can be very frustrating. Nobody knows that better than 18-year-old Rachel Cuddington. She also knows the importance of excellent ear, nose, and throat care at Hotel Dieu Hospital. The first-year office administration student at St. Lawrence College says that without an important surgery 6 months ago,
I'd either be blind or close to blind. And I don't really know, I'd probably be absolutely no hearing at all in my left ear with it plugged up constantly and weeping constantly. So I definitely think if I had not received the care, I'd probably be in a very weird state.
For a young woman with a dream to fulfill a passion for musical theater, Rachel knows how important her senses of hearing, sight, and balance are in being a triple threat: singing, dancing, and performing on stage and in life. Until recently, she adapted to challenges with her ears.
It started out when I was fairly young. My parents knew that there was something wrong because my speech was delayed a little more than other kids were, and I would say words really differently. So it was definitely something that rose to their attention, but they never really thought that I was like deaf in the terms that I needed to use sign language. Throughout the years, I had been prone to ear infections, which always made me sick with fevers, and I always had to stay home from school, and I wouldn't get to play outside, which is obviously not the norm these days.
There was one incident that stands out, one that may have created lifelong damage.
One of my friends, probably when I was in grade 2, brought in a bike horn, and they put it up against my ear and they honked it, and that caused my eardrum to kind of collapse and break. And then later on that day I had blood forming in my ear, and I told my mom, and we went to our ENT who was in Toronto at the time. They just slipped it off as an ear infection, and over the years my ear infections grew less and less until 2 years ago when I had been swimming at a friend's place for, I believe it was her birthday party. And her place is sat on a lake, so it's not the cleanest of places. And what had happened was I wasn't wearing earplugs at the time, so I guess some water got in and it started really kind of the motion of what was happening. What
her family physician thought was a painful ear infection turned out to be far worse. Eventually, Rachel was referred to the ENT clinic at Hotel Dieu, where she soon was sent for a CT scan, leading her care team to an important diagnosis.
So Rachel has something called cholesteatoma, which is a relatively uncommon but really well known ear disorder that's usually comes on after a history of previous ear issues, the more common ear infection issues that happen in kids. And for a small number, a portion of the eardrum becomes deficient or retracted. And in that space, they start to build up this debris, and that debris is very damaging to surrounding structures. And essentially, if it goes unchecked, it can erode through deeper into the ear and into all the things around the ear. And your ear is very close to a lot of important things, not only the ear structures themselves, the hearing things, but the nerve that makes your face move, and the inside of your brain, and a giant vein that goes to your vein as well. So all these structures are at risk from this process, and if you let it go unchecked, eventually you could have erosions into these areas and develop infections, which could be life-threatening, or at least very serious in some way. So with proper care, some patients with this can be managed in the clinic. If they have small versions of this issue, you can manage it by routine cleaning of the ear and just watching carefully. And if it gets beyond that, which is what happened with Rachel, is that the disease progressed deeper in where it couldn't be accessed through our usual techniques.
So in the spring of 2014, Dr. Hollins operated on Rachel's left ear.
Mostly what he was doing, he was trying to take out the cholesteatoma. However, the cholesteatoma was wrapped around 2 of my major bones in my ear, so we couldn't salvage them, unfortunately.
In the operating room, we go in and we actually get behind the eardrum and clear out all the disease and then reconstruct the deficient part of the eardrum. And then the hole is gone, and hopefully the hearing mechanism is also working. And sometimes these are more than one stage of treatment, because the hole is either very difficult to close, you can't get it all the way closed, or the mechanism for the little bones in the ear can't be reconstructed at the first stage, and you have to go back and do that at a second visit. So it can be pretty complex, and it's very finicky kind of surgery, done under a microscope because of the structures being so small.
Rachel will need a second surgery so Dr. Hollins can ensure the blockage not only was removed, but has not returned. He also hopes to reconstruct some of the bones in Rachel's ear in an attempt to improve her hearing. Rachel's right ear has moderate to severe hearing loss, so for now, she wears hearing aids in both ears.
When I was a kid, my hearing was a lot better than it is now, way better. And I hated thunderstorms, absolutely hated them because I hate loud noises. But I always liked the sound of the rain falling on the roof or like the pavement or stuff like that, and it was really nice. And I always liked the smell that it came along with it. And as time progressed, after I was swimming with my friend, I lost my sound, my sense of sound, and I couldn't hear the rain anymore until I got my hearing aids. And now I just don't want to take my hearing aids out when it's raining because I'm like, I really want to listen to the rain.
With Bluetooth technology integrated into her hearing aid, Rachel can easily listen to her phone, hear television, or even record lectures.
I asked my mom, I said, Mom, can you take a picture of my hearing aids because I want to post them on Facebook. So she took a picture of me wearing them from the front where you can't really see them at all. And then she took a picture of me wearing them from behind. And I was like, new hearing aids, oh my gosh, I love them. And my sister commented on it and she said, you have like bionic ears now. And I just commented back and I was like, I know, I'm a cyborg.
Rachel is looking forward to next summer's musical theater program in Stirling, where she will be able to hear the director more clearly, knowing when she's singing in the right key. And her role with the ENT clinic will be a lifelong one.
Dr. Hollins said that all my life I will have to go and I will have to always go to the doctor's appointments, make sure that it doesn't come back because there is a chance that it probably could come back.
Black horse and a cherry tree. I can't